Cancer is a common problem in North America and other affluent societies. Most people are afraid of cancer and consider cancer diagnosis to involve suffering and death. In affluent countries, more than 50% of people diagnosed with cancer are cured, and thousands of others live 5 years or longer. After this lesson, you will be able to modify the environment to protect patients who have neutropenia or thrombocytopenia. Use personal protective equipment when administering IV and oral chemotherapy and when handling excreta of patient within 48 hours of receiving chemotherapy. Teach patients strategies to improve body image changes occurring with cancer treatment. Explain the basis and effects of targeted therapy for cancer, and identify patients at risk for oncologic emergencies. Providing care to patients and families experiencing cancer is complex and challenging. The purpose of cancer management is to prolong survival time or improve quality of life. Without cancer therapy, most patients with cancer would die within months of diagnosis. Cancer therapies include surgery, radiation, chemotherapy, hormone manipulation, photodynamic therapy, immunotherapy, gene therapy, and targeted therapy. Surgery for cancer involves the removal of diseased tissue. If cancer is confined to the removed tissue, surgery alone can result in a so-called cure for that cancer. Prophylactic surgery removes at-risk tissue to prevent cancer development. Diagnostic surgery, also known as a biopsy, is the removal of all or part of a suspected lesion for examination and testing. Curative surgery removes all cancer tissue. Cancer control or cytoreductive surgery removes part of but not the entire tumor, also known as debulking. Palliative surgery focuses on improving the quality of life during the survival time. Second look surgery is a re-diagnosis after treatment. Reconstructive or rehabilitative surgery increases function, enhances appearance, or both. Side effects are generally associated with the loss of a specific body part or its function. You want to help the patient accept changes in body image by encouraging him or her to look at the surgical site, touch it, and participate in any dressing changes or incisional care that is required. Give information about support groups. American Cancer Society is one resource. The purpose of radiation therapy is to destroy cancer cells and have minimal damaging effects on the surrounding normal tissues. We are going to discuss the types, side effects, and nursing care. One type of radiation therapy is teletherapy. It's a distant treatment. The patient is not radioactive and there is not a hazard to others. Tattooing may be used to ensure exact location. Brachytherapy means short or close. The radiation source comes into direct continuous contact with tumor tissue. The radiation source is within the patient. Side effects can include skin changes and hair loss. They're local but are likely to be permanent. Some systemic side effects are taste sensations and fatigue, and the patient may develop an aversion for taste of red meat. There may need to be a change in lifestyle. Skin in the path of radiation becomes dry and may break down. Don't use lotions in these areas unless prescribed. And you'll also want to teach the patient to avoid sun exposure to the radiation site for at least 1 year. Nursing care will include to teach accurate, objective facts to help the patient cope. Teach the patient to not remove the markings. You want to teach them how to administer skin care. You also want to teach them how to care for xerostomia. And if bone is exposed to radiation, it is more vulnerable for fractures. Chemotherapy is the treatment of cancer with chemical agents used to cure and to increase survival time. Some of the drugs used for chemotherapy are antimetabolites, anti-tumor antibiotics, antimitotic agents, alkylating agents, and topoisomerase inhibitors. Combination therapy includes usually using more than one drug. This is more effective in killing cancer cells. Unfortunately, the side effects and damage to normal tissues also increase. The drugs are selected based on tumor sensitivity to the drugs, and side effects are expected. Nadir is when bone marrow activity and white blood cell counts are at their lowest levels after chemo. Table 24-2, page 415 of your textbook, provides a list of chemotherapeutic drugs. So let's discuss pharmacogenomics a little bit. A new approach to chemotherapy selection is checking the patient's genetic profile to determine the likelihood of experiencing dangerous side effects. Chemo is given on a regular basis and is timed to maximize cancer cell kill and minimize damage to normal cells, usually about every 3 to 4 weeks. The trend now is to give dose-dense chemo, and then higher doses are given more often. Okay, let's discuss chemo administration. Chemotherapy is usually administered IV because the drug effects are rapid and the agents are irritating to tissues. Very rarely are they put through a peripheral line. Usually the patient will have a port implanted. Only chemo-certified nurses administer these medications. This ensures special education and competency, but all nurses monitor the patient. Extravasation is not good. That is the movement of an IV needle that causes the drugs to leak into the surrounding tissues. Chemo medications are vesicants. They're chemicals that damage tissue on direct contact. If extravasation occurs using a vesicant, the result would be pain, infection, and tissue loss. Often, surgical repair is needed. Monitoring of the access site is critical during administration to prevent leakage. Treatment will vary with the drug. Anyone preparing, giving, or disposing of chemo drugs or handling excreta from patients within 48 hours of receiving chemo should use extreme caution and wear PPEs, eye protection, mask, double gloves or chemo gloves, and a gown. So now we're going to talk a little bit about some of the side effects of chemotherapy. Hemorrhagic cystitis can occur, cardiac muscle damage, and loss of bone density. A lot of times they will administer a cytoprotectant, which is a drug that protects normal cells from the chemotherapy. Hematopoietic system side effects can be life-threatening. They may change the schedule of the chemo. This includes anemia, neutropenia, and thrombocytopenia. Patients may experience infection, which is a common cause for death. They are at risk for sepsis, basically from their own normal flora. Biological response modifiers stimulate bone marrow production. We want to report any temperature change. Cultures may be needed and provide antibiotic stat. They may also experience alopecia, which is hair loss, and mucositis, which is open sores in the mucous membranes. Platelet counts of less than 50,000 may result in prolonged bleeding from small trauma. If the patient has less than 20,000 platelets, they may have spontaneous and uncontrollable bleeding. Transfusions are needed, or BRM, such as Numega. There will be an increased risk of CHF. You may also provide a erythropoiesis, which is stimulating agents such as Epogen, and then Procrit can improve anemia. There are side effects to these drugs also, such as hypertension and strokes, especially in the elderly. Some other side effects include nausea and vomiting. This is caused by local and central nervous system mechanisms. Emetogenic means that drug induces vomiting. Time frame varies with each drug. Anticipation may induce vomiting also. A number of antiemetics are used like Zofran, Kytril, Emin, Decadron, Reglan, and Ativan, just to name a few, and several may be used at one time for better results. You want to give on a scheduled basis like narcotics, and it's often given before chemotherapy. Next, we have alopecia. Alopecia generally is temporary. It usually begins to regrow 1 month after completion of chemo. The new hair may differ from the original hair. A hairless scalp is at risk of injury. They want to avoid direct sunlight. Teach them to use sunscreen. Okay, so let's discuss mucositis. These are sores in the mucous membranes, often develop in the GI tract, especially in the mouth. They're painful and interfere with eating and quality of life. Teach them to use soft bristle toothbrushes or sponge. No dental floss. No alcohol-containing mouthwashes. You may have to also provide swish and swallow preps that are available in most hospitals. Some are not to be swallowed, some are. Cognitive changes will include reduced ability to concentrate, memory loss, and difficult learning new information during treatment and for months to years after treatment. The blood-brain barrier prevents chemo from getting to the brain, but biochemistry changes do occur. It's termed chemobrain, reported most by females who have treatment for breast cancer. Then there is peripheral neuropathy. There is a loss of sensory or motor function of peripheral nerves and occurs most often from antimitotic and platinum-based drugs. Onset may be rapid. The most common problems include loss of sensation in the hands and feet, orthostatic hypotension, erectile dysfunction, neuropathic pain, loss of taste discrimination, and severe constipation. Teach the patient to prevent injury. No other intervention prevents damage. And then there is hormonal manipulation. Some hormone-sensitive tumors grow more rapidly, and some tumors require specific hormones to divide. Therefore, decreasing these hormones can slow cancer growth rate but may not afford a cure. Some drugs are hormone antagonists that compete with natural hormones at the receptor sites. A new class of drugs are hormone inhibitors. They inhibit production of specific hormones in the normal organs. Examples are Arimidex. It prevents production of estrogen in the adrenal gland and decreases blood supply of estrogens. Manipulation of hormones will have consequences such as masculinization or feminization. Okay, so let's discuss photodynamic therapy. First, we'll talk about the process. This is the selective destruction of cancer cells through a chemical reaction triggered by different types of laser light. This is effective in reducing the size of tumors and allow them complete removal in surgery. Most commonly used for non-melanoma skin cancers, ocular tumors, GI tumors, and lung cancers located in the airway. An agent that sensitizes cells to light is injected through IV along with a dye. It leaves normal cells faster than cancer cells. In combination with the laser, the cell damage occurs and death follows. Okay, so let's talk about the nursing care. The patient will be sensitive to light for up to 12 weeks after a drug injection. There is a high risk for sunburn and eye pain. They must wear a hat, eye protection, and clothing for protection. They want to use sun protection and be homebound for 1 to 3 months. Decrease all types of light, including pulse ox and electronic monitoring. Okay, we're going to discuss immunotherapy. Biological response modifiers. These are cytokines, which are small protein hormones made by white blood cells. They enhance the immune system, stimulates the immune system to recognize cancer cells and take action to eliminate or destroy them. Some are effective in supporting therapies such as colony-stimulating factors. Two common ones used are interleukins and interferons. Side effects will include that these patients can have generalized and sometimes severe inflammatory reactions. Fluid shifts and capillary leakage are widespread with edema forming in most tissues. This can be life-threatening. Patients receiving high-dose BRM therapy should receive care in an ICU or monitored unit. These effects are limited to the period of drug infusion. Symptoms of mild inflammation include fever, chills, rigors, and flu-like general malaise. Interferon therapy causes peripheral neuropathy. There is a decrease in sensory perception, visual disturbances, decreased hearing, unsteady balance and gait, and orthostatic hypotension. This PN may be temporary or permanent. Skin problems are also common, such as dry, itching, and pilling. Gene therapy is experimental as cancer treatment. It's not approved yet. An example would be a viral enzyme gene inserted into a brain tumor makes them more susceptible to being killed by antiviral agents. Some therapy is done by charging up the patient's own immune systems. Targeted therapy combines aspects of gene therapy and immunotherapy. There may be antibodies that are directed against cellular substance needed by the cancer cell for growth or substance in the cell's signal transduction pathway that is important in turning on certain genes for cell growth. Each person's cancer cells are evaluated to determine whether the cells have enough of a target. Side effect is allergic reactions. Let's discuss oncologic emergencies. Cancer is a chronic disease. However, a number of complications from the cancer and its treatment can occur. Early diagnosis and immediate intervention of these emergency conditions are essential to avoid life-threatening situations. These are sepsis, DIC, SIADH, spinal cord compression, hypercalcemia, superior vena cava syndrome, or tumor lysis syndrome. You want to refer to your textbook for specific nursing interventions for these critical complications. This concludes the lesson of care of patient with cancer. If you have any questions related to the content of this lesson, contact the instructor.